It's time now for your local hospital on the town. Brought to you by Sierra Nevada Memorial Hospital, Dignity Health. And now here's your host, Dr. Brian Evans.
Welcome to On the Town from your local hospital. I'm Dr. Brian Evans. I'm the president and CEO of Sierra Nevada Memorial Hospital, and I'm very pleased to have a special guest in the radio studio with me today. His name is Dr. Ron James. He's an orthopedic surgeon who has just started his practice here in Grass Valley. Welcome to the radio station, Dr. James.
Thank you very much, Brian.
Yeah, I appreciate you being here. So I want to get into a number of different things today with you, and I want to start with the basics. So you are an orthopedic surgeon. So what in the heck is an orthopedic surgeon?
Yes, an orthopedic surgeon is a person who basically puts people back together. So whether it's from broken bones, torn ligaments, or arthritic joints, I'm the person that addresses those problems at the very end. There are many people along the line that help you or help you get to a person like me, such as physical therapists, physiatrists, and even your general practitioner.
Okay. So if somebody has a bad knee, and I'll just use myself as an example. So my knee hurts, which literally it does hurt actually. Yes. So I'm wondering if you could take a look at my knee after this radio interview is over with, but maybe later.
Sure.
So my knee's hurting, and so I don't know if I need surgery or not, but I do know that it's bothering me and I want to have it dealt with. So where would I typically start to deal with that kind of an approach?
It still is best to run it by your general practitioner first. Mm-hmm. And typically they will take you down a normal course that will take care of the lion's share of problems. For example, your example of a bad knee, they will give you anti-inflammatory. They will give you different kind of treatments, medications, physical therapy, mm-hmm. some activity modification. And if none of that's working, then they will probably send you to somebody like me who will take it from there.
Okay. So not everybody that's got a bad knee or a knee problem needs an operation.
Not only that, they don't need an operation, they don't need an MRI.
Okay. So a lot of people are like, I need an MRI for my knee. Okay. And they don't.
Look, I mean, if you're watching baseball or you're watching soccer, basketball, the first thing the athlete has is an MRI, and then they go from there. So I think that we wind up getting a little bit of a mixed message there. Mm-hmm. Most things can be diagnosed by your general practitioner, or just even a simple x-ray will actually get most things. Mm-hmm. And the other side of that is, I know we'll talk about it a little bit later, but there's some advanced things that I do that require an MRI, and if you've already had one, then I can't do it later because you've already had your MRI.
So you want to time it properly.
You want to time it properly. Okay. You want that MRI to give you the most useful data possible.
Okay. So if I'm Kevin Durant, I might get the MRI right away, but if I'm
not
Kevin Durant,
that's right.
He could have one every game.
Although it seems like he had one. Well, I won't get into that.
So, Dr. James, so you are a physician who went into surgery, went into orthopedic surgery. Why did you do that, and what was your training like?
So when I started at Stanford University, like thousands of other kids who were pre-med, I kept going because I kept passing the tests. Right? That's the difference between the guy who's or gal who is a doctor and who isn't. We just keep passing the tests.
Keep studying.
And we kept studying. So it kept working out for me, and I either skipped the weed out classes or I didn't get weeded out. And so by the end of 4 years at Stanford, it was time to see what I can do with my bachelor's of science in biology. Mm-hmm. Probably I couldn't even be a barista at Starbucks,
right,
or at a coffee shop. But fortunately, I got into Stanford Medical School, along with 88 other people. So there was only 89 of us there.
Small class.
And had a great time. And I quickly learned that I wanted to be able to take care of a person more directly. Mm-hmm. Now, when I was at Stanford, I was doing esoteric research, a lot of bench science, and things that may help people 10, 20 years down the road, maybe. And so I was very experienced at the theoretical side, and that was actually initially where I was going to go. I was going to be a researcher at some university, and maybe I would do a little orthopedics, but for the most part, I would just be in the lab, with glass pipettes and things. Mm-hmm. But I learned that I had some hand-eye coordination and some skill at doing surgery, and I gravitated towards some of the people who were in orthopedic surgery. Usually they're kind of like fun, sporty kind of people. I didn't play any sports, but I still enjoyed that. And so that was where I gravitated. Plus, it was very difficult to get into orthopedics. And since that's one of the more difficult things to get into, I figured if I shot for the top and I went a little bit below, it'd be okay. But again, it worked out.
Got over the hurdle.
Got over the hurdle.
Okay. And in orthopedic surgery, it feels to me like there's a lot more subspecialties of orthopedic surgery than there used to be. It used to be kind of if you were an orthopedic surgeon, you did it all kind of a thing. And now there's a lot of different areas. So do you have particular areas that you're focused on or that you feel like you really enjoy the most?
Sure. It's difficult because there are all of these different subspecialties. But at the end of the day, it comes down to taking care of the patients. I think you would really classify what I do as kind of sports medicine, advanced sports medicine. Mm-hmm. And by that I mean people, if they got their presidential medal in PE, they think that their arthritis is sports related.
Right, right.
But so we're all kind of sporty. We have this idea, this more sporty person in our mind that we once were. But at the end of the day, whether it's sports injuries, whether it's arthritis, whether it's degeneration, most of the things that I deal with are there from activity. Mm-hmm. That's not true for some people who have arthritic conditions like rheumatoid arthritis. But we take care of arthritis, we take care of sports injuries, ACLs, rotator cuffs, and then we do joint replacements. Mm-hmm. So initially I'm up here to address some of the joint replacements, but we probably are going to open it up to a full gamut of procedures.
Comprehensive orthopedic surgery
That's right.
in the community. That's great. So if somebody is out there and they are wondering, what they need. Basically, you said start with your primary doctor. Primary doctor is going to run you through some tests, some treatments, and that sort of thing, and then they might land in your office. What kind of questions should they be prepared to ask you and get information on when they meet you for the first time?
So when they meet me for the first time, usually they have somewhat of an idea about what's going on with them. Mm-hmm. I think that I need to know just basic things like, what is your health like? What is it that you would like to do? What is it that you can't do right now? How would your life be better or worse if we did surgery? How would your life be impacted? Will you be able to go to Do you have any plans that are coming up? Will you be able to go to your daughter's wedding or things like that? So if you know that there's surgery coming up, then we need to know your sort of immediate and long-term goals. Mm-hmm. That's what's most helpful to me.
Okay. Well, Dr. James, we're going to take a quick break, and then we'll be back. I'm talking today with Dr. Ron James, who is one of the newest physicians to Sierra Nevada Memorial Hospital, certainly our newest orthopedic surgeon, also based out of Mercy General Hospital, and the chief of staff at Mercy General Hospital as well. We'll be back right after the break. Welcome back to On the Town at your local hospital. I'm Dr. Brian Evans, President and CEO of Sierra Nevada Memorial Hospital, and I'm joined by Dr. Ron James, an orthopedic surgeon, one of our newest orthopedic surgeons here in the community. Thank you for joining us, Dr. James.
Thanks for being here.
So you have a couple offices now. You said your primary office is in Sacramento, and you do a lot of surgery and work at Mercy General Hospital. Is that correct? That's
correct. So primarily right now I'm based out of Sacramento, and we have a vibrant practice down there. I have a number of associates who are able to take care of most of the work. I will typically wind up doing most of the bigger surgeries, but I have a full staff that's actually dealing with a lot of the other surgeries.
Okay, sounds good. And now you're in Grass Valley, so tell me how that took place.
Yeah, we're very excited about that. So we've already been seeing patients up here. Started in early June, and we're going to see some more patients this afternoon. And really, in our talks, I wanted to make sure that we kind of kept orthopedics here in Grass Valley. That's really what my focus is. I have a number of really, really great patients down in Sacramento that I've taken care of that came from Grass Valley. And they graciously come down, and I think that's something that people have been used to since elective orthopedic surgery has been wanting in Grass Valley. But people they're happier being closer to home.
Yep.
And what we do in medicine isn't just giving a medication or doing a procedure. It isn't as clinical as that. We're really here just to make people feel better. And people feel better close to home.
Yeah, absolutely. You said elective orthopedic surgery, and I want to stop on that for just a sec because there's sort of two categories of ortho, right? There's the emergency orthopedic surgery, and then there's elective, as you put it. So tell me about the difference between the two.
Sure. Elective orthopedics, we'll start with the emergencies. You fall down, break a hip, ankle, you break something, you really want it fixed, and you want it fixed now. That is emergency orthopedic surgery. You come to the hospital, they call somebody in, and they patch you back together. And, the hospital's been doing that, and that's been covered very well. But most of orthopedics is elective. Even if you broke your ankle, it doesn't have to be done that night. It can be done in a week or so once the swelling has gone down. It's easier for me to close the incision later, right? And so we want to be able to take care of the people who have more elective. What I want to do is, the elective surgeries are more planned surgeries.
Sure.
You know that you have a hip replacement coming. You know that your rotator cuff needs to be done. That doesn't have to happen this week, this month, sometimes even this year, but it does need to happen. And then we can plan what's best for you. You can have your family come here for support. Elective surgery is what most of the surgery is, and that's been lacking.
Yes. So from a surgeon's point of view, what's more interesting for you, and what procedures do you gravitate towards? I would think somebody breaks their hip, they weren't expecting that to happen, but you can fix it relatively quickly and get them up and moving again relatively quickly. To me, that would, but I'm an ER doctor, so that would appeal to me quite a bit. So, versus you've got somebody whose hip has been bothering them for years, and finally it's reached a point where you want to get them better, and maybe you get them really a lot better relatively quickly. What do you feel is the best part of ortho?
So, I think that they both have similarities, and so when a person just can't do something that they want to do, but it is still theoretically possible that they can do it if we do this surgery, being able to allow them to do that is great. For example, I had a person who was in elective surgery, a total hip replacement patient, and all he wanted to do was walk his daughter across the aisle 3 weeks after I did the surgery. Now it happened that the surgery had to happen very close to the operation, but there's a way in which we do it where there's a little bit less pain, and he was able to do it. And he brought me the picture of himself walking his daughter without a cane 3 weeks later. Now, everyone isn't going to be that way. Some people will take shorter, some people will take longer. But I think helping people, giving people their life back. This arthritis is crippling. It stops people from going on vacations. It makes them cranky around their loved ones, and it's this long, chronic thing. So I think that is a little bit more rewarding than even the emergencies. The emergencies are more artistically rewarding. So if you have a broken bone and you put it back together and it's nice and perfect, that's great. But the reality is if you've broken a bone, then your skin, fat, nerves, arteries, everything got crushed, and then there was still a lot of energy for the break to happen. Mm-hmm. So that whole limb doesn't function that well. Mm-hmm. And that's confusing to patients because the bone looks perfect, but their limb isn't moving quite as well as they thought it would be quite as quickly. So, yeah.
Sounds like sometimes expectations maybe on the patient side are not totally realistic. They think that they're going to be back at playing basketball the next weekend after getting their leg fracture fixed, that kind of a thing. But
that's right.
I do appreciate the fact that you said that I can blame my knee for being cranky. I think that's what I heard you say.
That's
right. So if somebody's accusing me of being in a bad mood, it's like, well, it's my knee. It's my, that's what I'm going to go with.
No, it's a real thing. I mean, if you've ever had the flu, if the loved one who's bringing you the toasted sandwich and the chicken soup turns the light on and you don't want it, you may snap at them.
Right.
But they're caring for you.
Sure.
And so having arthritis is a little bit like that, but just all the time.
It's like knee flu.
Knee flu.
Chronic knee flu.
That's right.
Yeah, exactly. Well, good. So it sounds like you really do want to get clear about what the objectives are with the patient before they go in. So you had one patient who his major objective was walking down the aisle with his daughter at the wedding. Do you think some people, they've got higher requirements, and sometimes maybe they're less, they just want to have less pain or something like that? Do you spend some time with your patients trying to figure out what their goals are?
Yes, I probably spend a little bit too much time, according to my medical assistant, with my patients. But to the extent that we're successful, it's because we're accurate. So I need to know what is it you're trying to get out of this. Sometimes surgery actually won't do it. Mm-hmm. I've actually canceled surgeries. I had a patient who had my goal for him was to be off pain medication and to fix this problem. And but he had other ailments, and he was going to stay on it forever. So there was no point in me doing this surgery, and he was happy for that.
Well, you got to be clear on the front end. We're going to continue the conversation after this break, and we'll be right back. Welcome back to On the Town at your local hospital. I'm Dr. Brian Evans, the President and CEO of Sierra Nevada Memorial Hospital, joined by Dr. Ron James. Thanks for joining us, Dr. James.
It's good to be here.
You're our newest orthopedic surgeon, working here in Grass Valley as well as in Sacramento at Mercy General Hospital. And we're really, really thrilled to have you here in the community. We have a big need for folks who have joint issues and other orthopedic issues, so it's going to be really good to have you here. I want to ask you about sort of advances, new things coming up in the realm of orthopedic surgery. There's cool new things coming out all the time. So what can we look forward to as consumers going forward? Are we all going to get our legs replaced by robotic limbs, or are we going to grow a new knee in the lab and have you put that in? What's happening out there?
Sure. So there are a lot of very far off technologies, but I'll just talk a little bit about what's here right now, and in particular, what's here right now, even in Grass Valley. So there's a number of different things that we do, especially on the total joint side, that are new. For example, you read a lot about stem cells and growth factors, things like that. There are little procedures we do where we inject FDA-approved things into people's knees and hips. So we do that. That's kind of on the clinic side. On the surgical side, when I went to our academy this year, it was just it was almost like a technology convention. There was so much robotics. There was so much augmented reality, virtual reality. There was 3D printing of every type. And some of those things we do right now. So, for example, we have the capability right now to obtain a special scan of your hip or your knee, turn it into a three-dimensional data on a supercomputer, and then print out a knee or a hip that is designed just for you. And we also have different blocks that will help guide my hand to make the cuts so that the templated implants fit perfectly. And we do that now. And that's available even here in this hospital. It's been tremendous to be able to have something like that. Cuts down on surgical time. It cuts down on my need to do x-rays. So it's quicker, faster, more accurate. Okay? And that's available here today, and that's FDA approved. There are some things that we do, like robotics, where we will wind up having, again, a special scan, input the data. I can, in virtual reality, do the total knee replacement with just kind of these color wireframed, it looks like the future. And so I can finish doing the knee on the computer, and then I bring the robotic arm in, and then I'm able to execute exactly the plan that I did on the computer. That's here today. Beyond that, there are different kinds of navigation packages, basically like GPS for your joint. So I can tell the computer where all of your points are in your bone, and then it can help me make different cuts and design your knee or your hip how we ordinarily would do it. And so all of these things are there to help me to be more precise with basically machining a human body, because there's going to be this in the future. There's going to be this melding of just man or woman and machine.
Yeah. So it sounds to me like the past way of dealing with joint surgery is, kind of eyeballing things, kind of looking at the bones, looking at the x-rays, making some best guesses as far as what may or may not fit well for a particular patient. And so now we're getting a little bit more precise. We're getting a little more custom. We're getting a little bit more clear about exactly how to remove the part of the joint that's worn out and replace it with something that's going to really fit nicely for that particular patient.
That's exactly right. So at the end of the day, do I think that having a trained orthopedic surgeon with years of experience, that's like 90% there. It's fine, right? If your doctor does that, that's the gold standard. There's nothing wrong with that. But we know that the data is on, let's say, knee replacements. 97% of knees are in 10 years after we put them in. And so we pat ourselves on the back. But we don't ask ourselves how many of those people are happy.
Right.
The answer to that is 80% are happy. 20% of total knee replacements are not happy. And the question is why? And I personally believe there's something in the small bits of rotation, the precision, things that you can't see as a human being. It could be that a Rolls-Royce is the best car possible to have, but that's a hand-built machine that probably is going to be in the shop all the time. Sometimes you just want a Subaru or a Toyota. That's going to get you there.
Absolutely.
Right?
Yeah. Tried and true.
Tried and true.
Absolutely. Well, good. So as far as patients that are out there in the community right now, they that like me are having pain in their knee, and they probably want you to take a look at it at some point. They're recommended to go see their doctor, and then if needed, and they need to see a surgeon at some point, you're somebody who could evaluate that for them. Your office is the Northern California Orthopedic Associates, is that correct? Did I get it right? Okay, NCOA.
Yes.
And 2 offices now in Sacramento and Grass Valley.
That's right.
Okay, so you're up and running in the Grass Valley office. And what do you think of the community here in Nevada County?
I love the community here. So when I first was apprised of the opportunity to come up here, I was very excited, not just for the opportunities for an opportunity's sake, but I had just the most lovely time with my patients from Grass Valley. And it really was the deciding factor of me coming up here. We understood that there was a need, but I'll tell you, of all walks of life, the folks in Grass Valley have been nothing but wonderful and kind to me. And so it's just nice to be able to come and work with people like that, since for the most part, I'm just trying to have a good day. And so if I'm kind to you and you're kind to me, and we're both trying to go to the same goal, I mean, that's pretty good.
Absolutely. Well, I've certainly experienced the same thing related to the patients here in Grass Valley, Nevada County. Very appreciative people. They are, they're looking to explore the outdoors quite a bit out here. A lot of people move to this community because of the rivers, because of the hiking, because of the biking and all that kind of thing. And in doing so, they put some wear and tear on their joints.
That's right.
But they want to keep doing those things. They want to keep enjoying the outdoors. They want to keep getting outside. So your services are extremely valuable to us and in full demand. So we appreciate you being in the community. Any final thoughts as far as what your overall goals are for your practice here, or your goals as an orthopedic surgeon? What kind of a contribution you'd like to make to the community?
So, I am in private practice, so there's a market forces aspect to some of this. But if we're able to fill the need here and it's working well here, then I like it here. I mean, I can see transitioning much or most of my practice up here. Again, as I said, I have associates down in downtown. It's not that it's not working down there. It is working there. But again, I'm trying to have a very good day. So my goal is to build things. I do total joint replacements for the most part. I'm trying to build things for life. And so there are many people in business nowadays. Some of the people, I know you may have your MBA, but some of these people are trying to just make the quarter better. Mm-hmm. And I think that I'm trying to build things that last. And so I've even spoken to some of the orthopedic surgeons here. What we want to do is bring back orthopedics to Grass Valley and make it something that is lasting so that people can be comfortable in their own community. Absolutely.
Well, that's definitely something that we are very supportive of. And this is a community hospital. It's from the community and for the community. And so we're delighted to have you here taking care of our patients. I'll be one of your earlier patients, I'm sure, having you check out my left knee so I can get back out on the basketball court at some point. That's my ultimate objective. Well, Dr. James, thank you so much for being here. Really appreciate your time.
Thanks for having me.
Very much. Let me know if you need any assistance going forward. And we look forward to a long career here for you and taking care of many of our patients here in Nevada County.
I appreciate it. Thank you very much.
All right. This has been On the Town at your local hospital. I'm Dr. Brian Evans, the CEO of Sierra Nevada Memorial Hospital. Have a wonderful day.
This has been Your Local Hospital on the Town, brought to you by Sierra Nevada Memorial Hospital Dignity Health. Listen to fourth Monday of every month to learn more about your local hospital.